disease. So we're going to talk today about deep brain stimulation, the updates on deep brain stimulation, and then we're going to talk a little bit in depth about the surgical options involving pump. And so there are now 3 pumps that are coming onto the market, and we're going to go through some of the details. And people here today will have the opportunity to potentially have some access to those pumps as well if they're interested. We have some demonstration tools, and then also we'll talk about the studies that are going to be enrolling involving the pumps as well. Okay? So I'm joined here today with Keith, who's, as he said, my right hand and my left hand man, and then also Madhuri, who is our research coordinator, and she's been working with us now for a little over a year and a half, I think now, helping to run all of our studies for Parkinson's disease. So let's talk a little bit about DBS. Has everybody heard about DBS? Raise your hand if you've heard about deep brain stimulation. Okay, wonderful. So deep brain stimulation is a technology that's been around for over 20 years, and Keith and I were actually involved in some of the early studies on the technology. And what it is a technology that involves implantation of wires with electricity generating tips. And those tips are implanted in 1 or 2 locations in the brain, and those locations are called the globus pallidus or the subthalamic nucleus. And the idea is, by putting this electrical system into the brain, we're allowed to reroute some of the aberrant signaling that's happening with Parkinson's disease to kind of offset some of the negative feedback loops that are happening with an electrical stimulation so that it can reduce some of the symptoms of Parkinson's disease. Now, Parkinson's disease is not cured by either deep brain stimulation or the pump. What they are symptomatic treatments that allow us to have a reduction in tremor, slowness, or stiffness. The deep brain stimulator does not have a big impact on gait, however, or balance. Okay, so that's something to keep in mind. Now, the deep brain stimulator oftentimes is placed in individuals who either typically have a good response to Parkinson's medication. So they need to be able to have a levodopa response, and usually the stimulator will be as good as their best medication response. But what it allows us to do is it allows us to reduce the amount of oral medications that we're using. And so oftentimes we're left with fewer side effects when we use the deep brain stimulator. And in fact, particularly for the target that I mentioned before, the subthalamic nucleus, oftentimes we can see a reduction in medications of 25, 50%, sometimes in some patients as much as 75%, okay? And the wonderful thing about that is it's often the side effects of the Parkinson's disease medications that can give us trouble, like drops in blood pressure, sometimes confusion, and dyskinesias, the wiggly movements. Parkinson's medications cause those things to happen, and so if we are able to reduce some of those medications, then we may be able to help people to feel better and to have a better quality of life. Now, deep brain stimulation, when we first started using it, we were using it in people who were in moderate or advanced stages of disease. And now what we're finding is that the earlier people have the technology implanted, the better they do long term. So for example, if somebody is diagnosed with Parkinson's disease and we know they're going to have the disease for 20, 30, 40 years, depending on how old they are, if we utilize the technology earlier, then we may significantly reduce some of those long-term complications of the medicine. And this is the most exciting thing. There is some preliminary research suggesting that people who are implanted with the deep brain stimulator early may have less progression of their tremor over time. More research is being done on that. The fact that deep brain stimulator is on 24 hours a day also has some added benefit for people in terms of sleep. Most people with Parkinson's disease can have difficulty with their medicines wearing off in the middle of the night. They might have tremor, stiffness, or slowness. And the deep brain stimulator, because it's on continuously, can really make a difference, we think, in sleep in people with Parkinson's disease. So that's something that's being evaluated right now in terms of non-motor aspects of Parkinson's disease. Now, some new things that are happening with deep brain stimulation. Number one, Boston Scientific, which is one of the 3 companies that make the deep brain stimulator, is utilizing a new type of technology to allow us to better program people with Parkinson's disease. What it allows us to do is it allows us to shape the electrical stimulation to exactly fit into the anatomical part of your brain where the little site is implanted. What that does is it allows us to get more bang for our buck, so to speak, and fewer side effects. So it's called shaping the electrical stimulation. So that's a new technology that Boston Scientific has come out with that we are now adopting. In addition to that, one of the other companies, Medtronic, has new technology involved with their deep brain stimulator as well. And the new technology for Medtronic is something called adaptive technology. And what that is, it's technology that uses artificial intelligence and sensing from the brain to modulate the effect of the stimulator over time. Now, why would that be important? When people are at rest, their brain waves related to Parkinson's disease might be lower. They might not have as much Parkinsonism symptoms at some times of the day versus others. Okay, so you know that yourself. Sometimes you're more shaky and stiff, other times you're not. But your brain stimulator right now is giving you the same type of signaling at all of the different times. What this technology hopes to do is to adaptively change the stimulation based on your brain waves, okay? So the technology, the little leads that are implanted in your brain, can actually sense something called a beta wave, which is directly related to abnormal Parkinson's symptoms. And then the device is set to trigger once you reach a certain threshold. So when you have more symptoms, the signaling will adjust to a higher voltage and hopefully bring it down. So this technology has been studied for several years now, and it has successfully demonstrated that we can make an impact on this beta signaling. And the idea is that if we can not just stimulate electrically, but stimulate more precisely and individually electrically, we might have even better outcomes. And I mentioned a higher stimulation, but when you're quiet at night or not having many symptoms, a lower stimulation to perhaps preserve battery life longer as well. So this is the newest Medtronic adaptive technology. Most of the individuals who are in our system are going to be eligible for that. And we've actually started rolling out this technology as of last week in our patient population. So it's something that we're very excited about and that may help to better individualize people's electrical stimulation treatment. So it's very exciting, hot off the press, okay? So that's what's happening with the deep brain stimulators. Any questions on that before I move on to the pumps? Yes?
How far in advance does one have to be to have that done?
Great question. So initially we were doing a lot of our deep brain stimulators on people who had disease, probably more like 10 years plus. But nowadays we're doing it earlier and earlier, and we have implanted people as early as 2 years out from diagnosis. Wow. And so a lot of it depends on the interest of the patient, and then you have to go through a screening process. The screening process involves on-off testing, which Keith does, where you come in off all of your medicines, and we do your neurological evaluation, and then you take your medicines and we do it again. We want to see a big difference between off and on medication in terms of some of your symptoms. That means that you're going to be a good responder to this therapy. So we do the on-off testing. We do a scan of the brain to make sure that there are no reasons why we can't do the surgery. And then we also do cognitive testing to evaluate your memory and your thinking. People who have moderate to significant memory issues are not a good candidate, and people who have moderate to significant mood issues, depression or anxiety, are not necessarily candidates because it's hard to modulate the electrical stimulation while those things are going on. So there are a lot of people who are very good candidates for deep brain stimulation, so if it's something that you're interested in, we can talk some more about that, okay? Usually you're evaluated by a movement disorder specialist and then sent to a neurosurgeon for the two-part surgery. The implanted leads, and those are connected to a wire underneath the skin and the neck, and then an implantable battery underneath the skin in the chest. And Keith and I do the programming onto the battery in the chest, okay? So that's kind of how that works. Okay, great question. So many people are candidates. Do you have a question?
Is it always in person that you do the programming?
The on-off testing is done in person and the programming as well.
And about the Abbott, do you ever use the Abbott?
The Abbott technology, so that's the third type of technology. Abbott technology allows us to program remotely. So if somebody spends 6 months of the year or something like that in another location, they can be programmed remotely. The Abbott technology in terms of the programming aspects are not as ideal, so we don't use them quite as much. Oh, look at
Keep talking,
Okay.
sorry.
So those are kind of some of the big pearls about deep brain stimulation. The nice thing about deep brain stimulation, it's continuing to evolve. And so they're utilizing the technologies and trying to improve them every step of the way to make it a better product for the patient. And typically, thank you, the upgrades in the technology are applicable to those who already have devices implanted. So upgrades, particularly with Medtronic, can typically be unlocked. Okay? Okay, so now I'm going to move on to the pumps. All right, so the idea from deep brain stimulation is that continuous stimulation is better than intermittent stimulation, okay? Intermittent stimulation is what happens with our medications. We take our medications, then they wear off. We take our medications and we wear off. And just like with diabetes, we find that the tighter and the more streamlined we can control, just like the blood sugar, the dopamine levels, people do better, okay? So if we can minimize those on and off, then we can improve people's functioning and have a more continuous aspect to things. So that was the rationale behind the pump. And the first pump was the Duopa pump, which actually took a liquid form of dopamine and allowed the continuous flow through a tube that was placed into the small intestine, okay? So it was administered through a surgical procedure with an implanted tube that then stayed in there for continuous infusion of the medication, all right? Now there were some challenges with that because as you can imagine when there's a tube that's coming through your stomach, there can be some complications in terms of risk of infection and movement and things like that. So that procedure and that technology, while still being used, is not used very frequently, not as widespread, okay? But thinking about that and the continuous nature of the treatment, people seem to enjoy, as long as they weren't having side effects, the continuous aspect of the therapy. And so newer advances were done to evaluate the technology related to continuous therapy. And the idea, just like from the insulin pump, was to develop a Parkinson medication pump where the medicine could be administered under the skin instead of into the stomach, into the upper and small intestine, okay? So 2 companies now have FDA approval for this type of a pump. The first one is called Onapgo, and that's a dopamine agonist. So it's not actually dopamine, but it activates the dopamine receptors, okay? And that medication is similar, for example, to something like a Mirapex, Pramipexole, a Ropinirole, Requip, or a Rotigotine. Nupro, okay? So that's how it works. So it activates the dopamine receptors. That medication, that pump, You put it on and it lasts for 18 hours and you take it off at night. Okay, so it provides continuous activity during the day and it's used to add on to the medicines you already have, but to provide a continuous flow of therapy. So with the ANAPGO treatment, the dopamine agonist treatment, you aren't going to reduce any of your other medicines, but you are going to have an underlying more continuous type of therapy. Okay? Now, the newest medication that's in a dopaminergic form is called Vraylev. And Vraylev is different. It's a 24-hour continuous infusion. And it also allows you to reduce some of your other medications because it's similar to using like a carbidopa-levodopa, a Sinemet type of a formulation. And it allows for a more smooth onset, so people have less of on and off and fewer dyskinesias overall. Okay? So right now it's approved with commercial insurance, but it also is very shortly going to be released for Medicare insurance as well, likely in the next few weeks. So we do have some paperwork today where people can sign up to be first on the list for that. And we do have some studies that are enrolling. We're just finishing up a study where we were evaluating the pump on 3 of our patients over a period of several years to see whether or not it was effective, whether or not they felt that they had good quality of life, and whether or not they had side effects, how we managed those side effects. And our patients who were enrolled in that study did very well, and the results were very good overall for the nation for people who were enrolled. Those patients are going to be offered to continue on with a continuation study, continuing to follow them over time, and then new people are going to be able to be brought on to that study as well. That study is looking at patients who are on the carbidopa-levodopa pump. Sometimes in addition, they already are on other medicines as well. And then there's another study that's going to be enrolling for people who are new to Parkinson's, new onset Parkinson's. Maybe they haven't been on any meds before, and the pump might be the first thing that they try. So that's going to be another study that we're going to be working with the company on as well. So a lot of options for people who are interested in utilizing the pump, and we have a lot of great experience, as I mentioned, over the years with making use of it to figure out how best to manage it for our patients. And our patients have done a lot of great work in terms of troubleshooting, and you guys will get to benefit from all of that, okay? So I'm going to pause here as well, just to ask if there are any questions about the pump. Yes?
When are they going to start reducing the size of the pump?
Great question. So let's look at the pump size. So this is the Vraylev pump. I'm just going to put my water bottle down so I can open it. Majori, do you want to do the demo for me? Or you're asking me? Yeah, go ahead. Yeah, try and do it that way. So this is what it looks like on the outside, and basically this is the way that we're able to control the rate of the infusion. And then you open this up, and you can see here there's a syringe that then gets filled, gets put in here, and closed up. And then there's a catheter that attaches to this. Keith has it. With a connector, so this attaches here, and then it gets connected right to the skin, usually in your abdominal area, okay? And what we've learned from the great experience of our patients is that if you move the catheter every day, you get fewer problems with skin irritation, okay? And we use the abdominal area more because there are some other areas you can use, like the lower back or the upper thighs, but that kind of gets in the way of activities. And you all are big exercisers, right? So this is what the system looks like. It's then put in a fanny pack and you wear it around your waist. Okay? And they are working on changing the size of the pump to make it smaller. What the rate limiting step is this syringe. So it has to be, at this point, big enough to hold the syringe. I suspect what they're going to work on too is this formulation of the liquid to try and make it more concentrated over time to also reduce this size as well. But for right now, this is the size. You take it off when you swim and you take it off when you shower, but otherwise you can continue to use it. Okay? Yes?
Are there issues with the receptors in the brain? Do those wear out or do they get?
Great question. So what's happening with Parkinson's is that the dopamine producing cells are decreasing over time. Okay? So there's less production of the cells, and there may be some irregularities that also develop in the receptors as well in the brain. Mostly it's a decrease in the number of cells though. So that's why if we're able to replace dopamine, typically people can do well. And particularly if we're able to use a continuous versus an intermittent response, it doesn't upset the receptors as much. Okay? So those are some of the theories behind why this seems to work so well for our patients. Great. Yes?
How long does that liquid medication keep? And does it need to be refrigerated?
It's a great question. It's a great question. So the refrigeration and the keeping of the medication, I'm going to talk about that a little bit, but I'm going to ask to see if my ambassadors want to come up to the front. Does anybody want to come up and chat a little bit about it?
Sure.
Come on down. All right, you want to talk a little bit about your experience?
I've been on the pump probably about 3 years.
Yes, yes.
And it's, like she says, it really eliminates off time. I have a continuous dose in my system 24/7. Right now with my dose rate and everything, one syringe lasts about 21 hours. So it's kind of like the tides, you know, I need to switch that thing all different times of the day. I try and monitor that and do it so I'm not getting up in the middle of the night to do it. But it's, you know, it takes some getting used to, but it's so beneficial. I mean, I don't have to adjust my food intake based on pills when you can't have high protein in your, and you have pills in your system at the same time. That doesn't work. I don't have to deal with that. You know, it's infused into my stomach area, doesn't go through my GI tract at all, so there's no issues there. There's so many benefits that to me, it's just like a no-brainer if you can qualify and get it approved, and it's probably not, unfortunately, may not work for everybody, but I think it's worth pursuing because it's really been. And I gotta admit, I was diagnosed in 2020, and within 6 months I was on the pump. So I don't have a long experience with pills, which I don't regret, I guess. But you know, it's my story's different than a lot of people. Like you guys have been on pills for a long time, and then if you switch, hopefully you'd see a dramatic change in your activity level. You know, it's allowed me to live a good life with Parkinson's, and that's what we hope for. So it's been wonderful. I didn't know what I was getting into when I started. I was just newly diagnosed. I wasn't sure, but I am so lucky and so fortunate to be in it. It's just a great thing. So.
Great. We have questions.
If you or can
Sure.
you say, does it help your anxiety at all?
Does it help your anxiety?
Yeah, I don't. My Parkinson's hasn't really been an anxiety thing for me. You know, I guess the only anxiety I have is if the syringe is getting low and where am I when that situation develops. And usually I plan ahead and have what I need with me to make that switch. So, you know, it's not an issue that really I have to deal with very much. You know.
So would you say it would help your anxiety?
It's a great question. You know, it hasn't been studied so far. In the studies, they were mostly looking at motor complications of Parkinson's, but the new studies are going to look at mood. They're going to look at cognition and the impact of cognition. Some of the concern that we have with Parkinson's is that some of the medicines might be causing some of the cognitive slowing. And so on a cleaner, and in quotes, therapy of just maybe the pump, does it improve people's cognition and their functioning in terms of their thought processing speed, etc. So that's what we're going to be looking into in a bit more detail as well in this new iteration. So more on the mood, the sleep, and also the cognition as well.
Yeah.
But our patients have done very well in terms of their cognitive functioning on the pump so far. You had any question?
Qualifies.
Yeah, it's a great question. So who qualifies? So we have a bit of a protocol set up in our institution in terms of who's going to be a good candidate, right? So number one, you have to be able to hook up this device to your skin. So you have to have some dexterity in terms of your being able to administer it, or somebody who can help you with that. And sometimes it's good to have both, right?
It is, yeah.
And so in addition to that, you also need to be able to kind of manage having something attached to you and what the logistics of that in terms of your day-to-day activity. And then in addition to that, if you're going to be the one changing your syringe, you have to have the facility to be able to do that as well. So there are some technical skills that you would be taught as part of the whole process. And then the other rate limiting step is the effect on the skin of the stomach. So this has been, I would say, our biggest challenge with this device is that there can be irritation that's caused, particularly if there's movement of the catheter where it's infusing. And so people can develop skin reactions, redness, swelling, some nodules can develop. And so it's important to understand how to reduce that from happening. So changing the sites daily helps. Another thing that we found is when people get very sweaty, if they don't change their clothes right away after their activity, then they can also develop skin issues. So we talk a lot about that in relation to exercise in the summer, making sure you're wearing clean and dry clothing or changing it as much as you can. And then at the early sight of a redness or any signs of infection, identifying it so that we can help you in terms of some people need a little antibiotic every once in a while if their skin is getting irritated as well. So those are some of the issues. And I think we did have one or two patients who wanted to have the pump early on in the study who weren't able to kind of manage the pump or feel good about what they were doing with the skin aspect of things. And so 2 of the 5 patients that we originally were looking at didn't necessarily want to continue with the pump because of that. So that's really kind of the rate limiting step with the pump.
Yeah, it's to change it or install the cannula. It's not a major effort, but it has to be done in the right format or the right steps. To do one part, then the next, then the next, and you really have to keep the site clean, alcohol swabs and whatever, and the site rotation is really important. I try and do it every 2 days. And if I stick to that and do that, especially in the times of the year where you get sweaty and stuff like that, it really eliminates a lot of problems. The other thing I will say is, with the pump, there's no I'm going to go for a swim and jump in right in. You can't do that, and you can't just jump in the shower. There's a few more steps to get that done, but it's definitely much more valuable than that inconvenience to have it. So, yeah.
You mentioned jumping in the, do you take everything off? What do you do before you get wet?
I disconnect the tubing from the cannula. There's a way to do that, and then you can put in a thing that blocks that while you're in the pool. And then I've tried waterproof bandages around the site while I'm in the pool. Some have worked, some haven't worked. But I found just any sort of bandage, depends on what you do. If you're really active, moving around and, I don't know, surfing or whatever, it's pretty vulnerable to getting hit and bumped around. And that's when, it might cause some problems with being pumped and then it loosens up. So you just gotta do a little bit before you jump in the pool or whatever to protect it. it's been just fine, yeah. And it, you know, it doesn't take that long to disconnect and get ready for that, so, yeah.
Thank you.
I just had a question about sleep. I know you said you were only on the pills about 6 months before you started the pump, but is the sleep any better with the pump or about the same, or, you know?
You know, I would say, yeah, it's probably a little better. I've always had an issue with sleep through the whole process, and you know, I think it's what I see is having the continuous medication there, that so I never develop, you know, off-time symptoms while I'm asleep or anything like that. So my sleep from that way is non-interrupted from those kind of things. And I, you know, I sleep with the pump attached. All, you know, I don't take the pump off or set it by the side of the bed and try and sleep that way. So it takes a little getting used to it, but that's definitely doable. That's not a real.
Does it affect your sleep when you first started using it? You didn't fall asleep?
You know, it probably did from the standpoint of, you know, beeping and, you know, what does that alarm mean and, you know, that kind of stuff. But, you know, you're using it all the time, so you get used to that stuff pretty quickly, and it just becomes a part of your routine. You know, it's just this is what I do every day, deal with the pump and get out there and do stuff. So
Stay active.
stay active. That's critical.
You had a question back there?
I do have a question. When the syringe empties, what is the drop-off like? Is there any, you know, maintenance? Is it an immediate off period? Is there any grace period?
So you're saying, like, if you're gonna go to the swim class and you disconnect, how long do you have for a window before you feel like you really need to reconnect again?
You know, for me, I really don't. What I do prior to something like that, or even the gym class today, we can adjust the dosage rate that it's being supplied to us. So I put it in the heavy dose situation, so I'm getting the maximum medication per hour. And if I do that like an hour ahead of class, it's already in my system at a higher level, so then I can, you know, I'm able to deal with it. And swimming, just because it's disconnected, I do that prior to the class. You know, I bump it up. And you can also give it pretty much an immediate infusion of medicine.
A bolus, you can give a bolus. And we're gonna train you guys on all of that too.
Yeah.
How to utilize your
Does that then
pump.
cause your syringe to empty sooner if you're using a higher dose?
Oh, yeah.
And you have some parameters. We give you parameters for low, base setting, high setting, bolus, and you can't bolus more than a certain number of times every day. And we get that all set up. It's very individualized. So everybody's pump settings are different. Just like your Parkinson's medicines or your deep brain stimulator is different. It's individualized to optimize your function.
I'll be here all day, so.
Great job. Thank you. Great round of applause. Okay, so very exciting. Now, what I want to do is I want to leave a little time too, because we do have everything set up over here for people to be able to sign up for the pump, the studies, to get your hands a little bit on what the pumps feel like and all of that kind of thing. And then we'll all be here for another at least 15 minutes to answer individual questions as well, okay? So thank you very much for coming. We're so excited to be able to launch all of this for you in terms of the deep brain stimulation updates and also the pump technology. So you're welcome to come on over and explore. Have a good day. Thank you.